All right, man, we're gonna go ahead and talk about this cavity prep real quick. So here's the x-ray right here. We're really focusing on that premolar there. As you can see here, there's not really a lesion. You can't really see anything. It's very, very faint as far as that occlusal surface on the radiograph. So we don't have anything there. But here's the tooth here. And so what you can see here now is the doctor is actually working in what looks like a diamond burr with the high speed, just kind of opening up those walls there to kind of expose that cavity there. So just kind of going along the groove pattern here and just kind of opening it up slowly but surely. But as you can see here is there's some decay there larger than what we saw on the outer aspect, and that's kind of what I showed in the other video. You know, like cavities or dental bacteria kind of works like termites. Like they kind of find these little small spaces and they just kind of work their way in and then kind of go underneath and undermine that enamel there. And so here we are, we're going in with the spoon here, just kind of cleaning out the rest of the decay there. Again, we're looking to see if there's anything soft, and we want to definitely remove anything that's soft because that's pretty much enamel and dentin that have been eaten away by the dental decay. Here we go with the, looks like a 6 round burr. We're going to go ahead and go in here, a little bit of irrigation there, and kind of smooth out and remove the remaining decay. And so again, you can definitely appreciate the amount of decay underneath that small cavity there. Because when we started, if you guys can remember, it looked like almost the size of a pinhole. Like it was very, very small. But as we're moving through, you can definitely see how much it has really fanned out and started to go underneath into that enamel, kind of breaking through the enamel, and then also into the dentin layer too here. So we're going to go ahead and go with the spoon here. Then we're going to go ahead and just smooth these walls out with the diamond burr, just kind of redefine and make sure that we've removed any decay, just so we can make sure that the cavity is clear of any remaining decay there. All right, so you can really appreciate it here. Got a little bit of chalkiness there. We're going to go ahead and get to removing that. And so now we've starting back to fill the cavity. Looks like we're putting a base there. Normally what I like to use is a Ventrapon, and that kind of helps to protect the pulp there. But then we'll go ahead and go in with that bond layer, and then following the bond layer, then we will also go back into the cavity with the composite and the composite resin. And so you can kind of appreciate the finished product here. This is what we had before. While we were removing the decay there, you can see that too as well. This is just what we consider a simple filling. So this is pretty much what we have going on when we're doing a small filling there. We definitely, the main focus is removing any tooth structure that has been infected by the bacteria that has made the cavity in the particular tooth. And so once we remove those things, we use a few medicaments, etch, bond, and then we also use the composite resin and then finishing burrs to finish and smooth everything down to make sure that it aligns up with your bite as well, is in the proper function as well as form, and it is aesthetically pleasing too as well, making sure that there's no open margins or anything like that to where we can have what's called secondary decay, meaning that there was a filling place there and then now we see that decay has found a way underneath that filling, and now we're starting to see some secondary decay there. So we want to do everything that we can to prevent any chance of secondary decay forming there as well. Okay. All right. So I think we've gotten pretty had an opportunity to really kind of dive in. You guys feel free to leave questions or comments. Again, this is one of the shorter, simpler filling. And that's the thing about cavities. You know, they can look very, very small on the front end. But you know, once you really open it up and kind of get in there, you kind of see, you know, how deep and how far the decay extends into the other layers of the tooth. And so that little small pinhole, sometimes patients can present and they'll be like, you know, my tooth is killing me. And it, you know, you look at the tooth and you're like, man, that's like a little bitty small thing. But then when you open it up, you can see the extent of how far that decay has really traveled down there. If you guys have any questions about, more complex fillings or different steps or medicaments or products that are used when we do these types of fillings, please feel free to drop those comments and questions in the chat. Again, this is a simple one. One of the prerequisites to when we're doing simple is, and that wasn't necessarily taken in the video, normally we'll do an exam as well as take x-rays to confirm. We kind of talked about that. You saw that, but the other part of that is we'll place topical to kind of get the numbing process started, and then we'll actually give you that local anesthesia in that particular area around that tooth so that you're not feeling anything while we're working on you too as well. So that's also very, very important too as well, and things to consider. You guys be blessed. I'll talk to you real soon. All right.